Hi there, this is Casey at Assisted Living Training School. Thank you so much for tuning into this video as we talk about you being hired as a caregiver and what to expect from your caregiver orientation. In Arizona assisted living homes and centers, it is required by Department of Health Services to have at least 10 hours of a caregiver orientation. Before you begin to work on your own, familiarize yourself with the facility and your residents. We suggest the following. Understand and go through the assisted living facility's philosophy and goals. With that, know and understand the internal facility requirements, like their policies and procedures, Department of Health Services rules and regulations. It is essential to know the policy and procedure of that facility, of whatever you're going to be doing in that home. If you are ever unsure or unclear, knowing where the policy and procedure book is, it's going to be so helpful. Otherwise, you can always ask your manager or supervisor. Being oriented on the characteristics and the needs of the residents you're taking care of. Who are your residents? Familiarize yourself with their routine. This is also a really great time to ask which of the residents are DNR. If you have not seen this paper yet, it's an orange form. It's a do not resuscitate form, so you know who not to perform CPR on in that facility. The next thing is how that facility promotes dignity and independence of their residents. What does privacy look like? What does their choices look like? And also their resident rights. Be clear on the significance and the location of the resident service plan. This is a great time to ask your manager or supervisor how to read and implement their service plan. Along with that, you're probably going to be oriented about their medications and ADLs, activities of daily living. How does that facility document those things? On the topic of medication, as a certified caregiver, you can administer medication. However, some facilities do have a specific role for medication administration called a medication technician. You may or may not be administering medication, but with the caregiver certificate, you can administer medication. Just check with your manager or supervisor. Now, if you're administering medication, that facility may have you go through a specific medication training program through that facility so you know how to administer medication according to their policies and procedures. This can also include how to properly dispose of a medication. And probably one of the most important things that the facility can orient you on is how to specifically document medication administration on the MAR, whether that be their routine medications, but what if it is an opioid or a controlled substance, scheduled medications. Also, the PRN or as-needed medications. With medication documentation, knowing where the pill book or toxicology guide is also going to be crucial. And if applicable, your manager may also let you know about food preparation, serving, and also storage. Your manager may also let you know on how to properly report an incident, whether that be a medication error, maybe you call 911, or another type of emergency or incident. Your facility may also have DME, durable medical equipment, such as Hoyer lifts, wheelchairs, walkers. It is great to be oriented on what the facility provides for its residents and how to use that equipment. And last but not least is required continuing education or in-service unit. Most facilities will require you to have 12 units per year. That's about 1 unit per month. That can be offered in the facility itself by hospices or by assisted living training school. Having open communication with your manager is crucial, as they are your point of contact and also the next in line of the chain of command. Thank you so much for watching. Please be sure to like, comment, and subscribe to Assisted Living Training School for more educational content and simplified learning for caregivers and managers. Thank you.